So what is my recommendation? My recommendation is if your doctor or your physician or any healthcare provider feels that you need opioids, you should have a conversation with your healthcare provider saying like, is my pain really that high that I need opioids? So pain is very subjective, meaning I cannot determine someone else's pain. It's a very subjective matter. So when people say I'm in a lot of pain, that could be relative to somebody else. So you should have that talk with your healthcare provider saying, hey, do I really need opioids? Can I manage my pain through other methods? Like we talked about ibuprofen, Tylenol. There's other kind of stronger versions of ibuprofen you guys could take that could help relieve your pain without being on an addictive opioid. So if you're a healthcare provider and you decide that opioids are the best solution for your pain management, what I would recommend is having try taking the minimal dose possible in terms of usually they're giving as needed. So whenever you feel pain, you should take it. So if your pain is managed through your other anti-pain medications, then maybe hold off on the opioid dose and take it when you actually really need it. For example, let's say you have a wisdom tooth pulled out, they usually give you ibuprofen, high dose like around 800 or 600 milligrams, and an opioid. So people usually get managed on the ibuprofen, but let's say 1 or 2 times they don't, it's too much severe pain, take the opioid. But it's as needed basis, not around the clock, meaning every day or every 6 hours you have to take it. And then one more thing I would like to recommend you guys is that if you guys are on an opioid, what they're doing now is kind of being more of a popular trend, is they give you the opioid medication, but they also, at the pharmacy, they dispense naloxone, which is an opioid antagonist, meaning it antagonizes it. So let's say someone has an overdose of opioids and they're like unconscious, you give them a dose of naloxone, which is, it helps them immediately withdraw from the opioids and help them wake up. They might wake up in pain, but they'll be alive and breathing. Remember we talked about respiratory depression, not being able to breathe, so it helps mitigate that risk. So those are my recommendations of opioids and opioid management with pain management. So to sum it up, opioids are a very strong painkiller that doctors or physicians prescribe patients to help manage their pain. It could be very addictive because it causes euphoria, very good feelings, or it causes you to get used to the opioids and your body needs it for pain management even whenever you're not sick or in pain. So like I said, try to take the minimum dose possible, try to assess that you actually need opioids or not, and also take an opioid antagonist or like naloxone with you. So I really hope you guys learned something today. I like making these videos, so if you do like them too, give me a big thumbs up. Make sure to subscribe for more pharmacy content, and thanks for watching.